Hypermobility syndrome is a condition in which someone's joints have a greater range of motion than is normal. This may go by many different terms, and for some people they may have simply referred to themselves as being double-jointed. In the most extreme instance, sometimes this is classified as a subtype of Ehlers-Danlos syndrome. However, no genetic test has yet been identified, which makes it distinct from some of the other subtypes of Ehlers-Danlos. The increased flexibility is linked to genetic variations, the genes in particular that encode for components of the connective tissue, such as collagen, elastin, or fibrillin. These components are crucial to maintain the strength and the stability of tissues like ligaments and other connective tissues around the joints. When these tissues are affected, these ligaments can become stretchy and loose. The muscles may not be strong enough to stabilize the joints properly. People with hypermobile spectrum disorders or hypermobility experience joint instability in areas like the knees, shoulders, hips, elbows, and ankles. This can lead to them suffering from frequent strains or sprains, or even dislocations. The severity of the pain can vary from mild discomfort to constant and disabling pain that interferes with daily work, and there may be associations with pain conditions like fibromyalgia. Although it can affect individuals of all ages, it seems more common in women than men. It's estimated that even up to 10 to 15% of people in the UK could have hypermobile joints, though much less at the more extreme end, and not everyone will require treatment. Some individuals are asymptomatic. Others experience significant joint pain, stiffness, muscle weakness, and fatigue. In the most severe cases, it's thought to be related to a group of connective tissue disorders known as Ehlers-Danlos syndrome. However, types of Ehlers-Danlos syndrome we have confirmed the genes for can present with a variety of more concerning symptoms such as elasticity being increased in the blood vessels or dislocations of things like the retina. At present, while this is hypothesized to be in the same spectrum in some situations, no gene has been identified, and treatment for people with hypermobile Ehlers-Danlos and hypermobile spectrum disorders can remain broadly the same. The cause is thought to be mainly inherited from one or both parents. As we've heard, specific genes haven't been identified, but ongoing research is searching for these. These variations mean that the structure, composition, or amount of these connective tissues produced is insufficient to provide adequate stability. There's also an association with hypermobility and its involvement in other tissues. This could include involvement of the gut, where you might get irritable bowel symptoms, which can be quite extreme. For others, it may involve changes to the autonomic nervous system or the automatic part of the nervous system that controls functions like our blood pressure. This can lead to a phenomenon called postural orthostatic tachycardia syndrome, where the body doesn't react fast enough to changes in posture. This might lead to symptoms like feeling faint or dizzy with a fast heart rate on standing up suddenly. To diagnose hypermobility, it starts as it would with most conditions, with a thorough history of your symptoms, followed by an examination. The examination may likely include something called the Baton score. This assesses the range of motion in specific joints like the knees, elbows, or fingers. However, you might be hypermobile in areas that are not examined by the Baton score, so it's not a perfect system. In some cases, imaging tests or blood tests may be conducted. If it's thought you have a very rare variant of Ehlers-Danlos that might cause extreme skin elasticity or cardiac issues, or conditions like Marfan's, you may be offered genetic tests, but these are often not necessary. The treatment focuses on managing the pain, but also crucially improving the joint stability. In the most part, this involves lifestyle modifications like regular exercise and physical therapy. You may be given some information on how to avoid stresses for the joints, and the exercises may include weight exercises and perhaps limitation of excessive stretching exercises, such as those in yoga. Pain relief may be provided, which could include anti-inflammatory drugs or simple pain relief like paracetamol. In more chronic pain, sometimes drugs that are used for things like fibromyalgia may help. This could include tricyclic drugs or SNRI drugs. Education plays a crucial role in managing hypermobility. Doctors and therapists can work together for treatment strategies or managing symptoms. Exercise is often guided initially by a physiotherapist who will derive a customized exercise plan to strengthen your muscles. Occupational therapists can be beneficial for managing hypermobility with things like splints or aids that might help with daily tasks. If there are features involving the gut, you may be given options of a specific diet and perhaps get support from a dietitian. Where postural orthostatic tachycardia syndrome is suspected, this could be diagnosed from specialist investigations like a tilt table test under the guidance of a cardiologist. Medications might be considered to try and help manage these symptoms. In rare situations where the subtypes of Ehlers-Danlos might be considered, a geneticist might be involved. However, unfortunately, no gene therapies are available for this condition, and it's may need to help understand if you require specialist monitoring, particularly monitoring of the aorta, which can become distended. To keep on top of symptoms, patients with hypermobile joints need to undertake regular and regimented strengthening exercises, and this can be challenging in the long term. For this reason, access to local support groups can often be helpful in providing further information and support in living with this condition long term. With proper management, though, individuals with hypermobility can live active and fulfilling lives and minimise the impact on their symptoms, on their daily activities, and overall quality of life.